Hi, I'm Phil Tank with the StarPhoenix in Saskatoon. I'm here talking to Professor Tara Moriarty, who's become very well known in Saskatchewan in the last week or so because of her research into excess deaths, which some has found controversial. Our premier called her research and also the reporting on it the most egregious misinformation. So we decided to bring her on for a more in-depth chat to sort of understand where she's coming from. First of all, welcome, Professor, and I'd like to know what your impression is about all of the controversy here.
Well, I mean, I think initially that some of it was probably a bit of a misunderstanding, that the Premier probably didn't realize that what he was talking about was a major peer-reviewed report from the Royal Society of Canada, or that's where the information was coming from. It's frankly, it's a little bit silly, right, in a way. I think that it's really important that people focus on understanding how many more lives will still be lost in Saskatchewan and how serious the current wave is, and that is what should be focused on, not fighting with the result of a major peer-reviewed study that was peer-reviewed by the chair of Canada's Commission on SARS from 2003, right? Like, this is not this is it's a serious report. So at this point, I think it would be very helpful to focus on preventing future deaths. Would probably be what I would suggest.
Okay, and I think what his focus has been was the conclusion that the deaths are 7 times as have been reported, which would mean there's about 6,000 deaths out there that we haven't talked about. And I expressed, if you recall, I expressed some skepticism about that when we spoke. Yeah. Can you address that directly? Like, do you actually think there's 6,000 more people who have died during the pandemic than we're aware of at this stage?
Yeah. So as when we discussed, right, as when we talked about this. I mean, that's always a possibility. We're not going to know for a couple of more years. It certainly was clearly true for 2020. That doesn't mean that held true through 2021. And we just don't have the numbers yet for 2021 because Saskatchewan death reporting is really incomplete. So in theory, yes, it could still be true. That's certainly a possibility. But we're not going to know for a couple of years exactly what that number would be. On the other hand, it's pretty clear that minimally there has been underdetection or underreporting, likely in 2021. That's somewhere between 2- and 4-fold underreporting, probably minimally, based on other types of estimates. And I think it's important for viewers to know that Saskatchewan's death reporting since the beginning of the epidemic, since February 2020, is currently about 60% complete, so 40% incomplete, because we also don't have any deaths at all that have been submitted to the Canadian Vital Statistics database since September. So there's still a lot more to come. And I think that that is the point, and that people should recognize that this is not unusual. I know it's shocked a lot of people. I think probably people didn't see the report when it came out, but anyone who reads The Economist, for example, has probably been seeing some of The Economist's work trying to understand how many COVID deaths have been missed worldwide and what the impact has been. And this is pretty conventional. This type of work has been going on for quite a long time even in publications like The Economist, The New York Times, and other organizations, Our World in Data, and others are all doing this type of work as well. And it's really common. In fact, it's the norm for COVID deaths to be missed. and it's the norm for as many as 50% of them to be missed.
So I listened to our interview from last week, yesterday,
Yeah.
and I did ask you whether that held, that pattern held into or through 2021.
Could be,
and
yeah.
You did say that it did. Are you now changing that, or are you,
well, I think when we talked about it, I had said it very well could be, right? So we were talking about whether it would be fourfold or more, and we were discussing whether there was a possibility. But what I was communicating was that it very well could be true, but we don't know until all of the data come in. So that was my understanding of how that discussion had gone.
So some people would say you're backing away from the 7 times. Are you not doing that? Are you doing that, or?
Well, I think I had always said that I as a scientist, I would never say that's what it is this year. I had said it could be possible, right? But there's a big difference between that. Do you know what I mean? Like I can't unless we have the data, but it could definitely be possible for sure. But we won't know until we get all of the data.
And what do you think of the reporting on this? Do you think, do you feel there have been inaccuracies out there? Do you see things that you think should have been reported better or differently?
No, I mean, I think that the reporting I've seen has generally expressed that this is a possibility. I don't think it's been absolute, and I think it's expressed that this could be true, but I haven't perceived any particular problems with it. And I thought that your own report on it as well was, I think the language, I read it as expressing that this is something that could also still be true. I didn't have any particular concerns with how it was worded. I think the way people perceived it, perhaps, perceived that it was saying that this is what it is, but I didn't get that impression when I was reading it.
And you've offered very publicly on Twitter to explain to the Premier or health officials in Saskatchewan, your methodology, how you went about this.
Yeah.
Have you heard back yet?
No.
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 Can you explain a little bit of your methodology? I know we can't get through the whole report today.
Yeah.
What are some of the elements that go in?
No, absolutely. No, absolutely. So, I mean, it's a bit more complicated than this, but basically what it is you look at the average number of deaths from 2015 to 2019, and you look at what the variation is in those deaths, like, because you need to statistically account for variation. And you look at the effective population aging, for example, because you know that that's going to cause some increased deaths over time. So you take that and we figure out what the upper confidence interval is of what we would expect for 2020, for example. And then we do things like, for example, we account for toxic drug deaths. We remove those from the estimates. We account for any other major non-COVID related deaths, larger numbers of deaths that are known about when arriving at the estimates. And then to be absolutely sure that we are not inadvertently missing toxic drug deaths, for example, because it's understandable that some of those probably wouldn't have been reported or captured. We focused, so in measuring or estimating the number of deaths above what you would have expected in previous years, we focused on the excess or untimely deaths in people who were 45 and older, because we wanted to focus on the age groups that were most likely to die of COVID. So that's how you get the estimate that leads to that 7-fold ratio. And then in addition, there are other strands of evidence that you look at. So for example, You look at antibody testing, seroprevalence studies done in different age groups to estimate what percentage of people in different age groups would have been infected. And you say, what number of deaths would we have expected from that? Does that look like the excess mortality number, or does that look like the reported COVID death number? And that looks a lot like the excess mortality number. And then we also look at other causes of death. So is there anything else other than COVID that would explain all of the extra deaths that happened in 2020, for example? And there were none. So this type of approach is commonly what's done in these big studies that are done to understand so how many extra deaths there were in a particular period, and how many of them were likely to be COVID or not. And so most studies that have been done on this worldwide have found that certainly through 2020, certainly till the end of the second wave, in most countries, all excess mortality has almost certainly been undetected COVID deaths. And as I've said, Saskatchewan is not unique in this. I mean, Saskatchewan and BC had a lower proportion of their total excess deaths accounted for by reported COVID deaths, but every province except Quebec had the same issue, and this is true in almost every country. So it's not at all. In fact, it's normal to find that there are likely COVID deaths that weren't detected. So that part that's a pretty standard. That's a pretty standard way of looking at that. It's not extraordinary in any way, and it's a very common conclusion. And Saskatchewan is not unusual in this respect.
So you say it's not unusual, but how does you did this for the entirety of Canada? How does Saskatchewan compare to other jurisdictions? I know our positivity rate has been high for the fourth wave. I know our testing has been lower than average, and I know we don't do postmortem testing like you said. Only Manitoba and Quebec do.
So I would say, so for the period that we covered in that report, Saskatchewan and BC had so Atlantic Canada had low numbers, but their numbers are so low that the certainty of those estimates are not as good. But Saskatchewan and BC had the lowest proportion of excess mortality that was accounted for by reported COVID-19 deaths. And Saskatchewan and BC are actually the provinces that also have the lowest per capita testing. And Saskatchewan certainly has had, over the course of the epidemic, 50% higher test positivity rate than the Canadian average, and tests 25% less per capita than the rest of Canada, and even less than the OECD average. So that's actually, those circumstances are exactly where you're going to miss deaths, right? Because you're not testing enough and you have too high a positivity rate to capture everything. And those are exactly the circumstances where there are deaths that go undetected. What's important to understand is it doesn't necessarily mean that they've gone unreported. So that's a separate issue. But especially if you're a province or a country that only reports deaths that have been laboratory confirmed positive COVID-19, even if someone dies with clinically consistent symptoms and they weren't tested before, Saskatchewan, for example, doesn't report that as a COVID-19 death. Some provinces will. So Ontario and Quebec will report those probables where it looked like COVID-19 and everything else. And in Ontario, at least early on, when there wasn't a lot of testing available, would certainly do that because they didn't have the test capacity. And those are listed in the Canadian Vital Statistics database as probables. But Saskatchewan only reports the positive. So then if that happens and you don't do postmortem testing, then even if you're clinically pretty certain that it was COVID-19, it still won't be reported as a COVID-19 death And that's really important to know if you don't have postmortem testing. And also there will be so people often don't recognize that there can be a fair bit of death in people's homes, right? Unexplained death, sudden death, and this is quite common for COVID, especially in older people. And so, for example, if you're talking about northern Saskatchewan, where there's been a lot of death in northern Saskatchewan over the course of the epidemic, if there wasn't very much testing available, if people were dying in their homes and were not tested, a lot of those deaths might not have been reported. So there are a lot of circumstances that would make it easy for a lot of them to be missed, right, and not included in the numbers. And then, there's the issue that based on the numbers of infections in different age groups and the stage of the epidemic and what strain was around and the vaccination rates and everything, that the reported deaths are also lower than you would expect for the number of infections that have occurred in different age groups. And sometimes, depending on the province, that may depend on when a death occurs after, for example, someone is identified as COVID positive. If they say, it's not declared a COVID death anymore if someone dies 2 weeks after they're clear of symptoms, for example, or appear to be resolved, then it might well be a COVID death, because we know a lot of COVID deaths happen in like a 6-month period. So it also depends on how that reporting is done. And that's certainly something that, journalists and others can ask more about. It's not that clear for Saskatchewan how it works. But that's one area where, depending on how that timeline is cut off, a death might not be declared a COVID death, even if someone had been positive at one point. So those kinds of gray areas can add up, right? You cumulatively have these bits and pieces of things that can lead to a fair bit of undercounting or missing or underreporting. And again, these are common in many parts of the world, many parts of the country. There's sort of a unique explanation in every place about why there are these issues. And you sort of have to try to figure it out over time and piece it together. And it's hard to get information too about how sub-provinces do this.
Yeah, so I did ask this the government here why we don't do postmortem testing, and I didn't get a response, and I don't think I will. So 2 provinces out of 10 do postmortem testing. Any idea why most provinces chose not to do this, or did they choose not to do this, or was it just something that they didn't think about early on in the pandemic? Is there something?
Yeah, so I know in BC that they chose not to do it. I think they did a couple of tests early on and decided that it wasn't something that was worth pursuing. I know that at a very early stage in Ontario that there was some exploration of whether there should be postmortem testing, but it just kind of disappeared. So I don't know why other provinces don't. A number of journalists have asked and can't always get clear answers. But people have been asking for, since this report came out, and actually even earlier than that. I'm not the first person to talk about this. This has been something that people will ask periodically, but never really get an answer.
So one last question, and it's probably a big one. So it seems obvious, but why is the research you're doing important? And I guess I'll put this in the context that there are lots of people out there, particularly the anti-vax groups, who want to minimize the deaths. They'll say, oh, those people were on the verge of death anyway, or oh, you're including people who died in a car crash but happened to test positive for COVID ahead of time, which, by the way, it's not, as far as the Saskatchewan government goes, that's not happening here. That's specifically, trauma is not going to be, so.
So yes, that is a really, really excellent question. And there are a couple of really a bunch of different important reasons. One of them is sort of simple human dignity, right? You recognize that a death has occurred, you count it, you give families, I guess, the dignity of that being recognized. So that's sort of a simple thing. The other thing, another thing is that we know that historically, the full toll of epidemics and humanitarian disasters is typically most easily measured by the total deaths, because it's one of the few things where we do, record details about deaths and how people died. Certainly in Canada we do. So much as this right now is, a swirling mess, I guess, it still is actually one of the most concrete things that we can measure about epidemics. But the most important thing is that you need to understand. So what happens is, as deaths come in, you get all of this untimely mortality, all of this extra mortality that's out there. And, in Saskatchewan, it's a lot, right? It's a lot compared to previous years. In Saskatchewan in 2020, there's no alternative explanation for it. Nothing else is popping up. But you have all of these extra deaths, much higher than historical norms. So from a medical point of view, you absolutely want to be able to understand what people were dying of if it wasn't COVID. So you need to have complete death reporting to do that. And this is going to become increasingly important as we go forward. So, for example, most excess mortality studies have found that through much of the world, through the first and second waves, that almost all the excess mortality was attributable to COVID. But the further along we've gone, the more disruption of the healthcare system, the more delayed access to care, the more delayed cancer diagnosis and treatment and everything else, the more we're going to start to see deaths that are secondary to that. And we actually really need complete and accurate COVID counting, because we really need to understand what proportion of those deaths are following on that. And we really need to watch for it. We need an early warning signal so that we can identify and respond. And in Quebec, for example, because Quebec largely counts or reports all of its COVID deaths, in Quebec, it's actually very, very easy to see these patterns. They also report very quickly, which helps. So in Quebec, consistently, during the periods when the mortality reporting is quite complete, you can see that COVID deaths are about 15%, reported COVID deaths are about 15% higher than all-cause excess or untimely mortality. And what people need to know is that excess mortality measures untimely deaths, people who died before their time. So we know from Quebec, because they report quite completely and very quickly, that about 15% of the COVID deaths in Quebec are probably people who would have died of something else during that time. And that is probably what with COVID deaths look like compared to of COVID deaths. And it actually corresponds really, really closely to the expected mortality rate in the age groups that are more likely to die of COVID. So in Quebec, you get this really perfect match between the number of deaths that be like, yeah, that's what you would expect to see in those age groups of people dying of other causes during that period. And some of them have COVID as well. And then the rest are untimely deaths that would not have died that soon without COVID. At least statistically, we can determine that. But all of these things require being able to look at this and understand this on a population level, on the statistical level. That's really crucial to understand what's going on. So if you're missing a lot of COVID deaths and not reporting a lot of them, and if that's kind of a mess, then you have a situation like the rest of Canada where we have a lot of unexplained mortality that's not explained by COVID deaths, but it also isn't explained by anything else in Canada. And that's a problem, because we have thousands and thousands and thousands of people who've died, and we can't explain why. And that's also why speeding up death reporting, like Saskatchewan, the best thing they could do right now is get that death reporting done, get it in there, get all of it completed, because that's exactly how we're going to find out if there are other causes of death that are a problem that need to be addressed, right?
Yeah.
Sorry, I know it's
Okay.
a
Well,
long explanation, but it always
yeah,
is.
yes, and we've kind of reached the end of our time. Thanks for
Yeah,
joining me. Thanks for further explaining this. It's always
sure.
educational, and
Yeah.
I think we've obviously touched on a controversial issue here, if nothing else.
Yeah, but it is, yes, it is controversial, but it is evidence-based, right? And so people may not be happy about it, but it's controversial in that sense. But this is it's still evidence-based, right? It's the way it is, and it's how we move forward with it that's important.
Yeah.
Yeah.
Okay. Well, thanks
Yeah.
again. Thanks again for
Okay.
joining.